Tumors of the spleen may be primary or metastatic. Any hyper- or hypoechoic nodule of the spleen should be considered to be neoplasia unless proven otherwise by biopsy or the passage of time without progression of the lesion or development of patient symptoms. Splenectomy is recommended with any lesion resulting in distortion or deformation of the splenic capsule. About 48 to 59% of splenic masses in dogs are malignant, and 51 to 73% of those malignant masses are hemangiosarcoma. This video is from a 13-year-old Basset hound showing a distended abdomen and pacing. Abdominal effusion was not present. Basset hounds are genetically prone to hemangiosarcoma of the spleen. Hemangiosarcoma should be suspected with cavitated lesions. The next video is from a 13-year-old Jack Russell showing restlessness and pacing. Ultrasound showed a splenic mass with abdominal effusion. The splenic mass was a metastatic lesion from a hemangiosarcoma of the right atrium of the heart. If hemangiosarcoma is suspected, a histology report of hematoma should be regarded with suspicion. It is easy to miss the actual tumor in a biopsy. If splenic hemangiosarcoma is present, metastasis has usually already occurred by the time of discovery of the mass. Development of metastatic tumors usually occurs within 3 to 6 months. This video was from a 10-year-old cat with hemangiosarcoma of the spleen. 5 months after the successful splenectomy, the cat was euthanized with metastatic hemangiosarcoma of the liver. Lymphoma of the spleen can occur in dogs or cats. Multicentric lymphoma in dogs usually presents with peripheral lymphadenopathy, but in about half of the cases, the spleen, liver, or abdominal lymph nodes may be involved. The spleen may be generally enlarged and hyperechoic or hypoechoic. It may appear enlarged and congested, or may contain hyper- or hypoechoic nodules. Biopsy is necessary to identify the neoplasia. This video is from a 12-year-old Munsterländer showing anorexia and fever of unknown origin. The spleen is generally enlarged and appears mottled or congested. Lymphoma was present in the spleen and liver. This video is from a 9-year-old Pomeranian showing a persistent hypercalcemia. The case was sent to surgery because the hyperechoic mass was in contact with the splenic capsule. Histopathology showed lymphoma. This video is from a 12-year-old 6-pound Chihuahua presented for anorexia. The mixed echoic splenic mass was a lymphoma. The mass was surgically removed, and the patient recovered to live 2 more years, eventually dying of congestive heart failure. Less common malignant splenic tumors are leiomyosarcoma, fibrosarcoma, and histiocytic sarcomas. Histiocytic sarcoma will usually show a solid hyperechoic central mass with or without cavitated lesions suggesting hemorrhage, as shown in this video of a 7-year-old Australian Shepherd. This patient had a low platelet count and repeated episodes of weakness. On biopsy, the central solid mass may appear pink or brown to the naked eye. Prognosis is usually poor. Mast cell metastatic lesions can appear as a discrete nodule, as in this 6-year-old Doberman seen after a dermal mast cell tumor was removed. The nodule was excised, sent for histopathology, and proven to be a mast cell metastatic lesion. Diffuse infiltration of the spleen with mast cell tumor can appear generally enlarged and mottled, as in this same Doberman after 22 months of chemotherapy. Ultrasound also showed diffuse infiltration of the liver. The patient was presented for vomiting and weight loss at the time of the second ultrasound exam. Note the hyperechoic fat around the spleen. There is also an effusion from the liver. Mast cell disease in the spleen may also appear normal on ultrasound. Splenic biopsy would be necessary to rule out or confirm mast cell disease. If ultrasound shows the presence of a mass or masses in the spleen, the liver should also be examined for signs of possible metastasis. However, if masses of the liver are seen on ultrasound, do not assume that they represent definitive proof of metastatic disease. Nodular hyperplasia of the liver can resemble metastatic disease. The animal in this video had a large nodule in the spleen, a small amount of effusion between the diaphragm and liver, and several hypoechoic nodules of the liver. The splenic mass was lymphoma. The liver nodules were lymphoid hyperplasia. This dog lived for several years after splenectomy. Conversely, the lack of ultrasound lesions of the liver does not rule out the presence of metastatic disease.